Thanks, Ian. So this evening I'm going to run through the background and context as to where we've got to and where we are, details of the Welsh Government offer, the GPC Wales recommendation to you all, and why this matters to all GPs in Wales. I'm suspecting that the presentation will take approximately 20 minutes or so, which, as Ian said, should leave plenty of time for questions at the end. So you'll have all have heard of our Save Our Surgeries campaign, launched originally back in the summer of 2023. And I'd like to think that the professional, political and public lobbying has started to gain some degrees of traction. In September, the Health and Social Committee have commenced work already on a report into funding into general practice, a cross-party committee. And as a result of the public petition, your public petition, we recently saw a Senedd debate on fair and adequate resourcing of general practice in Wales. 2 weeks ago, I had a face-to-face meeting with the Cabinet Secretary where I was able to discuss our concerns relating to the contract offer and the referendum, in addition to the issues related to national insurance contributions. And although I came away with no definitive promises, he certainly heard and understood the issues and was left in no doubt with regards the gravity of the position. You will have already heard and read about the issues around delays to the negotiations. However, it has been, the summer has been busy. We've been writing open letters to the First Minister and Cabinet Secretaries about negotiations and delays in those negotiations. The Save Our Surgeries Phase 2 campaign back in July of this summer. Plenty of media coverage, both national press and our own general practice press, plenty of coverage about our demands for progress. And I'd hope you'd agree that some constant and plentiful member messaging throughout. For the uninitiated amongst you, the negotiations are tripartite discussions between GPC Wales, Welsh Government and Health Board representatives, although I'd probably say in reality Health Boards are on Welsh Government's team. And you'll have already heard and know that the GMS negotiations were delayed. There are a number of factors at play here. Political chaos in Cardiff Bay. I think since the summer, well, in the last year, we've had 3 cabinet secretaries for health. There was the UK general election, the delayed reporting of DDRB until June. And whilst none of this is acceptable excuse or a means of letting them off the hook, it took, although our joint negotiating mandate was agreed back in May of this year, it took until September for the new Cabinet Secretary, Jeremy Miles, to sign off on the joint mandate so negotiations could start. We've engaged in a series of 4 negotiation meetings. We presented fully costed proposals and negotiated in good faith with Welsh Government and NHS Wales on their proposals with a view to the total value and acceptability of the deal, because, of course, it's important to remember that these are contract negotiations, not pay negotiations, as per secondary care. And there is obviously a difference. And we'd like to say that we engaged in the negotiations constructively, provided, as I say, our own costed, evidence-based proposals. However, we were very clear that the negotiations couldn't drag on and create further uncertainty, as we're very aware of how things played out last year. So from the outset, we made it clear we reserved the right to hold a contract referendum with the profession. You've already heard, the government's proposal was one that the negotiating executive of GPC Wales could not accept, and certainly one that I was unwilling to put my name to. And We then put the outcome to the full GPC Wales committee, who unanimously agreed to reject the deal on the table. And there's a consequence to put this to put the Welsh Government offer to the wider profession in Wales. It's going to run through some slides with regards to the content of the Welsh Government proposal, because obviously to allow you to make a reasoned decision regarding the offer, we need to give you some detail, and that in itself proved challenging, with Welsh Government initially refusing to allow us to publish any of the details of the negotiations, citing confidentiality of the negotiation process. So read into that what you may. But of course, we are a trade union which represents our members, and certainly not the optics of government policymakers. So we did it anyway. And the details of the best and final offer from Welsh Government have been circulated to members and additionally available on our website. Welsh Government have been willing to publicly announce the financial elements on offer: a 6% DDRB uplift, which in itself is hard to argue against. It matches the independent pay review body's recommendation, together with a matched 6% staff pay uplift for salaried GPs and all practice staff, together with £1.8 million towards the non-staff expenses. But what they haven't said publicly is their demand that the staff uplift must be paid in addition on top of the national living wage uplifts for lower paid workers, and that they intend to change the statements and fees entitlements, the SFE requirements, to actually mandate this. The proposal also states that the continuation of the additional capacity fund, you'll all know that's the 50-50 matched funding, for the £4 million of the Welsh Government money is conditional upon acceptance of all of the Welsh Government and NHS Wales's priorities within the negotiations, but does not include any of GPC Wales's mandate asks. So I think it's important, to not forget that to access this £4 million, our practices need to invest £4 million of their own money, and now to do additional work for the pleasure. We need to go back to the genesis, the purpose of the fund, and that was indeed to bridge the demand capacity gap that practices were experiencing. And by no means has that gap disappeared, but that money is now being repurposed. The Welsh Government caveats for continuation of the additional capacity fund all, to my eye, represent new contractual work. And it's a guiding principle for GPC Wales that in any of our negotiations and discussions, that resource must follow the cost. And the inclusion of additional requirements without investment falls foul of this. And the caveats and these the tiles in the slide show that to access and continue that money in 25-26, there's an agreement to review and amend the GMS Access Phase 2 standards, strengthening the evidence requirements and more regular reporting. Repeat prescribing functionality on the NHS app to become a contractual requirement for all practices. Learning disabilities annual health checks and maintenance of the learning disabilities register would be included within the remit of core unified services, and to move the current spend on that supplementary service and to move that into the global sum. But bearing in mind that probably there's only 30% uptake of that of that supplementary service, so in effect mandating that 100% of practices do 100% of the annual reviews on all of the patients, but for 30% of the money. Well, you can all do the maths of that. Practices would be contractually required to assess frailty and share that data with clusters and health boards, and similar requirements would apply to recording and sharing of patient ethnicity data. prescribing of oral antiviral medicines for COVID-19 for the immunosuppressed. Currently, a health board action would fall under the proposal under the remit of core unified services. So, although the details of these proposals hadn't been bottomed out and would be brought in for the next financial year, it's clear that each of these elements would create additional workload, but with an inadequate resource being offered in return. So you've heard the negotiating executive and the full GPC Wales committee have rejected the proposal. So, why are we recommended that within the referendum that you vote to reject the proposal? I think it's probably worth setting a little bit of the financial context before we start. And I know that many of you will perfectly understand the mechanisms of the uplift calculations as used currently in the contract negotiation outcomes. And, as we've said, Welsh Government will openly talk about the 6% uplift to GP pay and a 6% uplift to staff pay. But many people, ask, how does that actually get translated into a national quantum figure? And hopefully this slide goes some way as an explainer. So, a total contract value of around £470 million is split into the various elements of GP pay, employee pay expense, and general expenses. And those proportions, as on the slide, are calculated from the expenses earnings ratio from the official HMRC tax returns, albeit a number of years in arrears, which itself creates issues. And so it's to those elements that the DDRB 6% and the staff pay uplifts are awarded, but not to the entirety of the contract value. And apologies, I don't quite know where the BMA logo sort of managed to slide in the corner of that slide, but we'll move on. And you'll have seen from previous slides that the Welsh Government proposal using that methodology represents a total investment of approximately £24 million. But we would argue that this investment is woefully inadequate. And annually, we urge that Welsh Government separate the annual GP and staff pay awards from the wider contractual changes, and we've, as is the case in other nations, and they continue to persistently disregard that request, and coupling the financial investment to the negotiation outcomes indeed is a barrier, and it delays practices of receiving a much needed uplift. With regards to our proposals and our costings, for general practice pay, we asked that Welsh Government invest approximately £10.8 million into contracted GP pay in recognition that last year's non-agreed pay uplift fell short of the DDRB recommendations, and indeed the previous year's omission of GP practices from Welsh Government's pay enhancements that they gave for secondary care doctors. With regard to salary, GP and staff pay, of course, we support fair pay for all our employed staff, having previously introduced a mechanism in the SFE, which ensured that the salary GPs and practice staff had to receive those uplifts. This works when the investment allows, but the Welsh Government proposal offer does not allow the 6% uplift they want, and also needs to take account of the national living wage increases as of last year and indeed next year. And it was our ask that staff expenses uplift takes into account the national living wage and the pay uplift, and I'll talk a little bit more about that in a moment. Practice expenses, they're offering £1.8 million. Probably too small to actually figure on this on this graph. And we asked for a sufficient expense award of £8.6 million that allowed practices to cover the unavoidable practice costs that would in itself then realise the DDRB's recommendation for contracted GPs. Again, taking into account the inadequate expense awards of previous years when inflation was running high, and indeed an uplift for this year's inflation. But all in all, the shortfall between the Welsh Government offer and our ask, there's a shortfall of about £22 million between our costed asks. And I would argue this is within the grasp of Welsh Government to address. Because, whilst we were negotiating back in October, the Cabinet Secretary announced £28 million of investment into waiting list initiative work, a sum larger than the entire increase in the investment proposal for GMS for the year. And again, last week, a further £22 million, so a total of £50 million has been announced with regards waiting list work. So, it's clear that whilst there is money available for the NHS in Wales, the Welsh Government, despite all of the evidence from our Save Our Surgeries campaign and our negotiation papers, and despite their repeated warm words, they've deliberately chosen not to invest in general practice. So I've already alluded to some of Welsh Government's hidden demands, and within their negotiations, it was made clear that their expectation that the staff uplift element of 6% for all staff was to be paid in addition to the national living wage uplift of 9.8%. And they proposed to change the SFE to actually reflect that and mandate that. But, their offer only covers a 6% uplift. So there's also in that an inbuilt, inherent lack of understanding that it's not only those at or around the national living wage that needs to be uplifted by the 9.8%, and of course that is a legal duty as of April of last year. But the increase itself confers what I would describe as a band inflation effect, and whereby, to avoid the concertina of pay rates, all staff need to be uplifted to some element, or otherwise the bottom catches up with the middle and the middle catches up. Exactly, you all know what I mean. And we've calculated that the consequence of the national living wage uplifts and the band inflation would cost the average practice around £38,000. And that in itself would be in addition to the in-out pay uplift of 6%. And so I'm sure that, following all of that, and I know there's plenty, lots of practice managers on the call today, and you certainly will understand, those financial difficulties with many practices on the brink of financial unviability. I think that passes the Scrabble test. I'm never quite sure every time I say it. Is that right? Grammatically, I'm not sure, but you know what I mean. With practices on the brink, this was a red line that we're just not willing to give way over, and this doesn't need to happen. This is government will, and they need to understand. They need to back down over that, or the consequences will be dire. The DDRB report itself states the expectations that uplifts will be sufficient for the full value of their recommendation, 6%, the recommendation for the GP pay uplift, salary GPs, contracting GPs partners, but should be reflected in the earnings of the contracted GPs. And the negative effect of the government's proposal on practice profitability, with no positive mitigation in return, will have significant ramifications. It goes without saying, partnerships to survive are going to continue to have to make hard-nosed business decisions. And by that, I mean, reducing the expenses, reducing staffing levels, making cuts, making redundancies, reducing staff pay, reducing non-essential services. We've pointed all this out. Otherwise, and we know from our survey that, partnerships, and partners are already reducing their partnership drawings. But how long can that continue before, as we know, in the last 12 years, 100 practices have handed back their contracts, but ultimately this is going to continue. What did we want to see? And I'll run through some of our key headline asks, and a progress towards resource restoration. And we're looking for a commitment towards resource restoration, as per our Save Our Surgeries campaign, from the highest political levels. I think I've outlined that we need to see a GP pay award that meets the DDRB, but also restitution for previous years, but one that is enabled by an adequate expense award. The staff award needs to take into account minimum wage increases and non-staff expenses awards, bearing in mind the sub-inflationary offer of previous years. And I think the one child to increase the SFE entitlements for parental leave, sickness leave, and suspended doctor cover, etc. You're all aware that that's fallen behind the current locum market rates and hasn't been uplifted for many years, and we wanted to update that. As we've alluded, the additional capacity fund come into a close at the end of this 3-year deal. So we wanted to look at a replacement for that. Item of service fees for vaccinations, again, not been uplifted for many a year, and indeed look at that in its entirety, the cliff edges, the thresholds, etc. What could be done about those. And finally, we've asked to review the partnership premium scheme, ensuring it remains attractive and a good option. And I'm sure that you'd all agree that none of the asks from our side of the mandate are unreasonable. And despite negotiating, discussing each element, none of these have been included in a final offer or even negotiated with. Of course, those of you familiar with our Save Our Surgeries campaign will be familiar with this slide, and the root cause of lots of our issues is the chronic underfunding of general practice year on year, and this graph demonstrates our analysis of the percentage spend of the NHS budget spent directly into general practice, and showing a clear decline year on year since a high point back in 05-06. Right. And what does that mean at a practice level? Well, as you know, it's creating real sustainability challenges in financial terms. Less money to employ sessional GPs and other staff, less take-home pay for GP partners, and less money for to pay the rising bills. And as any GP will tell you, independent contractors cannot run a deficit, so they're forced to make do with less, until, of course, they can take no more. In negotiations, we pushed hard, as I say, for political commitment from the Cabinet Secretary towards resource restoration, and that is yet to be forthcoming, despite acknowledging, and in the debates in the Senate chamber themselves, all parties acknowledging the key tenets of the Save Our Surgeries campaign. Why does it matter? Well, the future of general practice services is relevant to each and every GP and every GP registrar in Wales, whether you're a partner, a sessional or salaried doctor, whether you're working in a managed practice or an independently contracted practice, or thinking about your future job opportunities post-CCT. This referendum matters to you all. You are voting on the future of general practice in Wales, your future. This year's proposal is just the latest in a series of financial deals that underfund and underappreciate the role of general practice in Wales, and we cannot continue with that current trajectory. I would say that we've reached a point where we need you to stand up and to be counted, so that Welsh Government hears the united voice of the profession in Wales and calls upon them to return to the table with an improved proposal that truly tackles the key fundamental critical issues facing NHS general practice in Wales. You'll all be aware of the recent changes to national insurance contributions that were announced in the autumn budget statement, the Westminster autumn budget statement. BMA members will have received an email containing a practice calculator to estimate the financial impact of employers' national insurance contributions, and being able to write a templated letter to your MP and now MS lobbying for a reversal of central Treasury policy. I've written directly, and it's an open letter that has been made available to you all, written directly to the Cabinet Secretary regarding the impact upon practices. As a result of the budget, there will be considerable funds available to the NHS in Wales. It is absolutely up to Welsh Government how they spend it. But unfortunately, the early signals aren't good. I attended the NHS Wales Confederation conference recently and listened to Jeremy Miles set out his priorities for NHS Wales in his keynote speech. And there was no mention of primary care. And indeed, his response in the public petition debate in the Senedd just a few weeks ago, he explicitly stated that the money would be spent to alleviate secondary care waiting lists. So the early returns from the calculator on the BMA website suggests a cost of around £32,000 to £35,000 to the average practice in Wales. And of course, that in itself is 25-26, and our referendum itself relates to the year that we're in, 24-25. The negotiation's still ongoing. It's only December after all. But a budget that was designed to alleviate the pressures on the NHS could have exactly the opposite effect. I'm going to close with some final slides reminding you of the goals of the Save Our Surgeries campaign. They're on a bit of a loop, depending on how fast you can read, but never before have these goals and objectives been more true. I'm going to finish, but I ask you all, those of you that are able to vote, to reject the Welsh Government's offer. I've asked you all many times before the rhetorical question, if not now, when? But today, this evening, I'm going to be as bold as to give you the answer. And the stark reality is that it's now or never. Thanks.